Bariatric surgery is a life-changing procedure that not only affects someone's physical appearance, but their mental health as well. Local mother Kristen Oliveira shares with us how she had to change her behaviors with food in order to live a healthier life.
Hi, Kristen. Kristen Oliveira used to dread seeing her doctors. She struggled with type 2 diabetes, high blood pressure, and obesity since she was a teenager.
It's taken me a long time, but I've realized that I was using food as a coping mechanism to deal with past traumas and things that I've gone through in my life. Primarily, I would say sweets was like my addiction. Sweets, Pepsi, like I would get up in the morning, go to the store, get a 40-ounce Pepsi. That was my coffee.
It was a year and a half ago when Kristen, a 34-year-old mother of two, finally had enough.
I was tired all the time, like I had no energy.
Her mother, aunts, and husband all had bariatric surgery at Fresno Heart Surgical Hospital with Dr. Keith Boone. She knew Dr. Boone was the one who could help jumpstart a change in her life.
Our number one reason to do the operation is for the diabetes and for the medical problems. And that's why you'll hear the term metabolic surgery more than weight loss surgery. In a way, we look at the weight loss as a nice side effect of the surgery we're doing for her diabetes.
Dr. Boone describes the type of bariatric procedure Kristen had in February 2021.
Kristen had the Roux-en-Y gastric bypass, which is a little pouch about the size of your thumb. And it's hooked up to the intestine, and that's called the Roux limb. It meets the bypass stomach a little bit downstream at the Y, so that's the Roux-en-Y gastric bypass.
Dr. Boone says the benefits from gastric bypass surgery can be immediate.
85% of our patients that have diabetes leave the hospital immediately off their diabetes medicine. So that tells you that it's more the anatomy of the surgery and the changes with the surgery and the changes of the gut hormones with the surgery.
But the long-term changes really come from the patient's willingness to adjust to a new lifestyle, including changes to their diet and exercise routines.
I kind of had it in my head like, oh, I'll lose weight and everything, my happiness will automatically just be there and I'll be happy 24/7. And that's not the case. There's a lot of work that has to be done on the other side after surgery. And if you're willing to put your heart and soul into it, it's 100% rewarding and beneficial.
Kristen dealt with depression and anxiety even before her surgery and says the COVID-19 pandemic didn't help.
Just because I'm trying to lose weight doesn't mean I still don't like something sweet. And
Kristen used social media to help her mentally get through the issues she's had with food. She's lost 50 pounds and finds support from others who have had bariatric surgery. And she enjoys inspiring others with her story.
So it's just getting the word out there that, listen, this is going to be hard, but there's so much reward on the other side.